Good afternoon. Welcome to the Joint COVID Task Force briefing. I'm going to begin with some slides and then turn it over to Chief McGowen for some comments. Total COVID-19 cases reported to date over the course of the pandemic, 196,464. New cases reported today, 2,549. 576 of those new cases are pediatric cases. The 7-day average of cases per day is now 2,305. That is a slight decrease from the 2,409 average we reported this time last week. Next slide. The test positivity rate has increased rapidly and is currently at 36.6%, which is also a slight decrease from the 42.4% positivity rate we reported last week. Next slide. The effective reproductive number, or RT, of the virus is now 1.67, down from 2.02 reported last week. Any RT greater than 1 indicates that each case is infecting more than one other person, meaning that the epidemic is growing rather than shrinking in the community. Total COVID-19 hospitalizations as of January 12, 2022, 770, with 134 in the ICUs and 636 in acute care. That continues the upward trend in hospitalizations we have seen in the past several weeks, and it indicates that COVID-19 is increasingly straining our hospital capacity. Next slide. As this graph shows, Shelby County's daily new case rate of 218.1 per 100,000 is more than double Knox County's rate of 83.3 per 100,000. Next slide. Shelby County also remains higher than Hamilton County's rate of 165 per 100,000. Next slide. But the daily new case rate in Shelby County is lower than Davidson County's new case rate of 257.2 per 100,000. Next slide. Currently, there are 27,301 active cases in Shelby County, which is an increase over the 23,892 active cases reported just 1 week ago. The greatest increase in cases have been among 18 to 24-year-olds, 25 to 34-year-olds, 35 to 44-year-olds, and 45 to 54-year-olds. But the cases have increased across all age ranges, also with significant increases among children and older age groups, including 65 to 74, 75 to 84, and 85 plus. Next slide. This map shows active cases by zip code, with the darker areas indicating that there are more active cases in those zip codes. Next slide. And this map shows the active pediatric cases by zip code. The same thing, with the darker areas showing where more active cases are in those zip codes. Next slide. This graph compares average case rates of children aged 5 to 18 years old in the 6 metro counties of Tennessee. Shelby County, shown in blue, shows a significant increase beginning in mid-December and remains much higher than any of the other metro counties. Next slide. This graph shows vaccinations by vaccination date, with first, second, and third doses shown in differing shades of blue. In the past 7 days, 10,763 vaccinations have been given in Shelby County, which is an increase of more than 1,100 since last week. Next slide. Here, you see the breakdown of the vaccinated population by age. 58.3% of Shelby County's overall population has received at least 1 dose of vaccine, and the percent fully vaccinated, having completed a series of 2 doses or more, is 50.1% of the population. The age 65 to 74 population is the most heavily vaccinated, with 79.6% fully vaccinated. And if you look at the 18 plus population overall, 60.5% of that population is fully vaccinated. And if you look at those who have had at least 1 dose in that 18 plus age group, 69.8% have received at least one dose. 25.9% of children ages 5 to 17 are now fully vaccinated, but we would like to increase all of those percentages. Next slide. This slide shows the progress we've made toward our goal of having 70% of the population in Shelby County fully vaccinated. More than 469,000 residents are now fully vaccinated, representing 50.1% of the total population. So we still have a great deal of work to do to reach that goal. Please remember that only 17.2% of our population has received a booster dose so far. This is the end of the slides. The Omicron variant is now the dominant strain of COVID-19 in Shelby County. According to the latest sequencing results, more than 90% of the samples sequenced were Omicron. Those are tests that were collected from December 22nd to January 3rd. We expect that trend to continue. As a reminder, the Health Department's immunization clinic is offering COVID-19 vaccines to anyone age 5 and older, including booster doses for anyone 12 and older. Hours are 8 a.m. to 4:30 p.m. except for official county holidays. No appointment is ever needed. We are also working with community groups to offer vaccinations at community events this Saturday. COVID-19 vaccinations will be available at Hickory Hill Community Center at 3910 Ridgeway Road on Saturday from 10 a.m. to 12 p.m., Hollywood Community Center at 1560 North Hollywood from 2 p.m. to 4 p.m., and at Baptist Women's Hospital at 6225 Humphreys Boulevard from 2 p.m. to 4 p.m. And with that, I will turn it over to Chief McGowen for a few comments, and then we will take questions.
Thank you, Dr. Taylor. So I appreciate and want to thank everybody who heard us last week as we asked people to please seek out alternatives for testing in lieu of going to the emergency room. We have seen a decrease in the number of people presenting themselves at the emergency room simply for testing. So that is a credit to people who are hearing the message and taking the appropriate action. That's a credit to our community partners. We now have just shy of under 30,000, the ability to do more than 30,000 tests a week, just a little under that. I think it's 28,500 last count. And we're thankful to all of our partners who allow us to have that capacity for the public drive-thrus and the private partners who are delivering it. We know there is still some frustration with respect to the rapid tests, and that is shared by everyone, not just here in Memphis and Shelby County, but across the country. You've probably seen some updates from the president that they anticipate those 800 million rapid tests being shipped out as early as next week. But thank you all for doing the right thing. Tune in to your local radio and TV station. There will be some public service announcements coming out to tell you more information about rapid tests, testing locations, and also providing information about how our hospital systems are doing. I mentioned to you last week that we are not immune from the effects of the pandemic. You have seen some data recently from the city of Memphis, and I believe from some of our other partners that are sharing the number of employees that we have out due to either quarantine or isolation. That means that some of our services are being impacted slightly. We are doing our best to keep those core services open and operating. But we thank you for being patient as we all navigate this together. Just a few services that are being impacted this week in the city of Memphis. Our solid waste service is having some impacts. There are some areas of the city, we've divided the city into 5 areas, and one of those areas is seeing some pretty dramatic impacts because of absenteeism attributed to COVID. So we're asking folks for a little patience. Present your can to the curb, and if it's not collected on your day, we will try to be back the very next day to pick that up. But we will come by and get it. We have not forgotten about you. Our park system is having some staffing challenges. All of our community centers are open, but some of the programming that you may be used to where we had open play and you could just show up as a group and play. We're having to restrict that to about 50% capacity. And we're asking that you go to the Memphis Parks website to sign up for a slot so that we know we have staff there to help you with your recreation. Our Memphis public libraries are all still open, but we are asking that people comply with the social distancing guidelines, and we have suspended temporarily the in-person programming where we gather groups together in the library. So you as an individual can go, you and your family can go, but the group participation has been suspended until we have sufficient staff to ensure social distancing protocols. And finally, the Memphis 311 system, when you can report problems operationally, we typically have 12 to 13 people staffing the phones. We were down to 5 people this week because of isolation and quarantine, but rest assured the phone calls have not let up. So we have the same volume of phone calls that we've had, but half the staff to handle that. So we appreciate everybody's patience as we navigate. We are not alone. I was on the mayor's call this morning, and all of our cities are facing challenges with our staffs. And so we're doing our best to provide the services you can rely on. I do want to mention to everybody that though there is no mask mandate in place, Dr. Taylor and her team have done a good job of requesting that authority to do what we think is right, but we don't quite have that yet. But just because there is no mandate doesn't mean that you can't take the appropriate safety precautions yourself and as your family. And I want to say again, thank you to the people of Memphis and Shelby County. Have the occasion to travel around to other cities. And it is just the norm here that most people wear their masks when they're out and around other people. In other cities, that is not the case. So I'm asking you all to continue that as we navigate this pandemic. Some of the peaking that we're seeing and some of the numbers coming down a little bit are really because we are all coming together. It's too early to determine if there's a trend. So we're going to wait for another week before we declare that we've peaked. We've seen this happen before. The last thing I'll mention is that our hospital systems do continue to be incredibly stressed. Dr. Taylor and I were on with the leaders of our local hospitals. Across the state, the Tennessee Hospital Association has sent a letter to the governor and the commissioner of health asking for some policy relief so that they can do the things that they need to do with additional staffing, expanded scope of practice, and suspending some of the normal inspections that would otherwise kind of interfere with day-to-day hospital operations. So we're looking for some response. I think that went to the governor earlier this week, and so we'll look for some response to that. But the message I sent last week is still true today. While we didn't quite get to the number of hospitalizations that was forecast, that is a good news story. But remember, we're still more people in the hospital than we've ever had in this pandemic attributed to COVID. And unlike the previous peak, our staff is even shorter than it was before. The hospitals are not immune from the effects of COVID either, and so they are even more short-staffed than they were when we had our previous peak. Part of the issue that makes this so challenging is that unlike the Delta, where we had some therapeutics in the form of monoclonal antibodies, we do not have that here. We don't have that in sufficient numbers to treat the number of people who have Omicron. And further, a question that many people have about the oral therapeutics. We also do not have that in a volume. I think the state of Tennessee received 6,000 or so courses of that in their first shipment. You would expect by population we would get about 600 here in Memphis and Shelby County, but 600 to 1,000. That's not a lot for the number of sick people we have. Dr. Taylor and her team are working with the State Department of Health, who is asking the federal government when we might get more of those oral therapeutics, when we might get more of those monoclonal antibodies that work for the Omicron variant. But today we remain challenged. Our best defense is for people to not get sick, and I know what a challenge that is for everybody. So please do what you can to stay safe yourself and keep your family safe, and continue staying the course by doing the right thing as we have been here in Memphis and Shelby County. So with that, I'll stop and take any questions.
Reminding all of our participants in the queue to unmute themselves at this time. First up, Brad Broders, ABC 24.
Thanks a lot. Doug, just a quick follow-up question, kind of segueing off of your comments about the hospitalizations. I know we're at a record high, and Do you have any sense of, thankfully the cases are down the last week, or it appears to be, but what are hospitals telling you all about just the concerns of how their hospital peak's going to be? Obviously, it's a lagging indicator, and what impacts that's having on, elective surgeries, et cetera. And I'll follow.
Sure. Well, that's an excellent question. As you know, should our case rate begin to coming down, the hospitalization we would expect to continue to go up because it is a week or two behind. So though we're at 700 plus, the numbers may go up and down a little bit. They are still concerned that their hospitalizations could still go up. Our leaders are committed to doing the right thing. They are redirecting staff from every part of the hospital who are qualified to do work on the floors. The executives, who are all licensed practitioners, are actually on the floors doing patient care. Elective surgeries, that's a topic I'd like to just spend a second on. Elective doesn't mean that it's some kind of cosmetic surgery that can be waited, that you can just choosing to do. Elective is everything from hip replacements to valve replacements in your heart to these critical things to patients' health. So if I was to say that they suspended all elective surgeries 100% of the time, you would have many other critically sick people who are in need of things that are quote unquote elective. So they are managing the electives in a way that keeps their staff available to them. And that is a concern. Clearly, you can't just stop what are quote unquote electives, even though they're categorized that way. So we have a regular dialogue with the medical directors. Every week we have a surge team meeting with the hospital system so we can hear regular kind of a drumbeat of what the concerns are. They are managing the best they can. As I did say, they reached out to the governor and asked for many things, some policy relief, but also to the extent that they could get some staffing from either the National Guard or the Department of Defense. If you've watched the national news, they have sent some military folks to different states other than Tennessee because of the demonstrated demand. Many of those folks actually come from, and Dr. Taylor can attest to this, they are actually practicing in the hospitals already. They just happen to be reservists and they get called up. So if there is help, it will be on the way when and if the governor gets that declaration and if there is staff available to help. Dr. Taylor, do you want to add anything to that? Okay.
Thanks, Doug. And as a quick follow-up, I know you had mentioned the rapid test, and it's a little out of your purview. Obviously you all have the testing sites in Shelby County, but any kind of update of what you're hearing from the availability of it and what kind of relief that will be when hopefully those federal supplies arrive in the weeks ahead?
Thanks, Brad. So we actually have been in communication with the Tennessee Department of Health to try to get even more rapid test kits in the county. We are nearing that, and we will have more of a plan next week once we know how many we will have access to and how we plan to distribute them. But those plans are in the works because we know that a lot of folks either cannot get their hands on one because they're in such short supply, and we have a lot of people in our community who frankly cannot afford to go out and buy multiple tests, but still need some type of test to know what their status is, either just so that they can protect other people in their family and the community, or so that they can return to work.
Mandy Rock, Fox 13.
Hey, good afternoon, everyone. I just have a couple of testing questions. So I've spoken to a couple of health experts who say that the rapid nose swab tests and the take-home tests may not detect the Omicron variant quickly enough, and some are saying that a throat swab could provide a better result for those rapid tests. But then, of course, we know that most at-home tests require the nasal swab. So just wondering, if you've heard that and what the advice is to people who are taking these tests. Is it possible for them to swab their throats for a sample, or should they seek out other forms of testing like PCR?
That's a great question, and I have heard that too. So I would have to say that whatever the package insert says on the rapid test is what people should do. And a lot of the test kits now are addressing those concerns about whether they detect the Omicron variant. So just make sure that you're paying close attention to the language on the box. But of course, the other thing I would say, just being a pediatrician, we know that if people are doing a test at home, we can't necessarily stop them from going off label and swabbing their throat instead of swabbing their noses. But the recommendation would be is to follow the instructions as they are written to try to get the most accurate test result that you can.
Thank you so much. And my second question, also testing related, is just as the demand to get testing is surging, the BBB is just warning some people of some fake COVID testing sites across the country. I'm wondering if you've heard of anything like that happening here and how people can know, if a site is legitimate or not.
That's a great question. So we have had some reports of that around the country. What we would say is that if you do encounter a location that you think is not real, and we have a full list of community testing locations on shelby.community. So if you encounter a location that you have questions about, the best thing to do is to call the police, but you can also report it to our 222 mask number as well so that we can investigate and see what's going on.
Kelly Roberts, WMC TV.
Good afternoon. Actually, I was going to ask what Mandy asked too, but I want to reiterate something. Have you had any reports of possible fake testing sites or sort of scams dealing with testing sites in Shelby County?
We have had a few reports, and those are being followed up by the Memphis Police Department.
Okay, thank you. Also dealing with tests and those rapid tests that the Biden administration is supposed to be sending out. I know that part of that was about $5 million to go to area schools. I'm wondering if you know how that kind of distribution would affect our area schools here. I know that SCS has been doing some robust testing of students and staff. What are the discussions like with area schools? Are you aware of any other districts who are going to ramp up testing during this Omicron phase of this pandemic? Thanks.
Great question. So just like Doug talked about how we have a weekly meeting with the hospitals, Dr. Randolph and I have a weekly meeting with representatives from school leadership to talk about a number of issues. And like you shared, the schools have already been doing a lot of robust testing in different forms depending on the district and what their policies are. It's a bit early to know what that allocation will look like from the federal government, but as soon as we have more information, we'll pass it on.
Okay, at this, one more question from Jasmine McCraven.
Good afternoon, Dr. Taylor. You guys have talked a lot about staffing issues and the stress of hospital staff. Do you know if hospitals are seeing people with coronavirus and flu infections simultaneously? And what about emergency services? Are you also getting reports of ambulances being backed up and taking longer at hospital drop-off locations?
So I'll answer the part that I can, and then I'm going to switch it over to Chief McGowen. So we know that the hospitals have been stretched beyond capacity, but are still seeing people as best they can and providing all of the services that people are presenting for. But with that, we also know that a lot of people in the hospital may have COVID, but may have originally been hospitalized for something else. And so I don't have the breakdown of those numbers to know what the different groups are, but what I can tell you is that one way that the hospital tries to keep down transmission is that everybody who is admitted to the hospital gets screened. And so, yes, you will have some people who present, have COVID-19, require hospitalization for COVID-19, but then you do have some people who present for something else, whether it's their diabetes or a heart attack, and then they incidentally test positive for COVID. All of those people are included in the number because they're all COVID positive, and they all give us a data point to know what's going on in the hospitals. And it helps the hospitals to plan for what type of staffing they need to do. But at this point, we don't have a breakdown of the difference. We just know that right now, the hospitalization numbers have increased. They will continue to increase. And like Chief McGowen shared earlier, it's important for us to continue to do the things out in the community that we know work to slow down transmission so that we do take pressure off of the hospitals and make sure that we're keeping everyone in our sphere of influence safe and COVID free. And I'll turn it over to Chief McGowen to answer the ambulance question.
Well, thank you, Jasmine. It's a great question. I appreciate you bringing it up. The simple answer is yes, there is an impact to emergency medical service. That is not anything that is unusual for a very big city like the city of Memphis. All it does is add pressure to the entire system. So just a bit of explanation, our paramedics from Memphis, Shelby County, and all the surrounding areas, when they deliver a patient to the emergency department, they stay with them until they are handed off to a nurse who will take that patient into the ED. There is a relationship between the ambulance provider and the health system provider at the ED that we don't just dump patients, so to speak. We actually do a firm handoff. And our paramedics will stay with the patient until such time as there's medical staff available. We typically like to see that happen in under 30 minutes so our paramedics can get back on the street. This is something that we also talk to the hospitals about quite a bit. When they get very busy and when they are understaffed, wait times for paramedics with patients can go into the hours. Well, every hour that a paramedic is in the ED is an hour that he is not on the street and available to pick the next patient up. So we have a very good dialogue between the fire departments in Shelby County and the hospital systems. We have a system that has been developed, green, yellow, and red. And the issue becomes when the fire departments get to the point where they may not have an ambulance that's available to respond, they will move to a yellow condition, which alerts everybody that we're about to run out of ambulances, so to speak. And then they will go to red, meaning it is imminent that I might not have an ambulance to respond. We have coordinated this with the hospitals, and when we get to that condition yellow, everybody is a heightened sense of alert. And when we get to red, the hospitals and the EMS providers just agree that we will quickly hand the patient off so we can get more ambulances on the street. That has been going on for a number of years now. It's exacerbated by COVID. I mentioned last week that we are down firefighters and paramedics, just like they are doctors and nurses and respiratory therapists and medical assistants at the hospitals. So it's just amplified times 2 or 3 in the current environment. So, but we are doing the very best we can to ensure that when you call, if you need us, we can be there. The last note I'll make on that, in addition to people doing the right things, wearing your mask, not going to the ED for just a test, there are individuals who call 911 routinely and ask for a ride to the hospital for things that where an emergency department is not appropriate, the appropriate level of care, perhaps a toothache, some other kind of an issue that's a psychosocial need. Some people just need a ride across town. We have a program that works with those individuals to try to get them to the right level of care. And so I would ask everyone to pay particular attention to people in your community, in your family who are vulnerable, to make sure that they have their needs met, that they don't unnecessarily need a trip to the ED. Many of the trips that we see are trip and fall. Elder person who has forgotten to take their medicine and they end up going to the ED. If you check in on them and make sure they're taking their medicine, that there's no trip hazards in the home, a little bit of extra care can avoid an unnecessary trip to the emergency department that adds to the strain that we have. So asking all of us to watch out for each other so that we don't have any of those additional unnecessary strains on the system.
Jasmine, your follow-up?
Thank you. That'll be all.
That is all the questions we have at this time. Are there any closing comments?
I'll just mention again, I ask everybody's patience and everybody to pay attention. to people around them and what needs there might be. I failed to mention that our transit system is also challenged. I mentioned that last week, but MATA is having a pretty dramatic impact on their drivers, which means that we can't get around to see everybody as often as they need to, so they're having to scale back service. There still is the opportunity through 901 Ride Choice. If you dial 901 Ride 901, you can get a ride to a testing site or a vaccination site, and I would encourage people to do that. That's through some of the shared economy assets like Uber and Lyft and those kinds of assets. So please take advantage of that. I would ask everybody to please stay the course, encourage people to get vaccinated who are not. We are inching up the charts on the percentage of people that are vaccinated, and that is our best course. I'll reiterate something Mayor Strickland put in his weekly last week. 0% of the people in the ICU were fully vaccinated and boosted. 85% of the people in the hospital are unvaccinated, or in the ICU are unvaccinated. Only 15% had any level of vaccine protection. So the vaccinations work from preventing, and they may not prevent you from getting the disease, just like the flu vaccine doesn't prevent you from getting the flu, but it sure does make your symptoms a heck of a lot less. So I encourage you all to go get that, and let's normalize this as part of what we do. Thank you all, and we'll be back next week.